Hello everyone, my name is Aloha Catbaggin, and today I will be presenting my capstone project titled Improving Transition to Practice Preparedness Among Newly Graduated Nurses Through Experiential Learning in Medical, Surgical, and Telemetry Settings. This project focuses on supporting newly graduated nurses as they transition into high acuity clinical environments and improving competency development, communication, and patient safety outcomes. The problem addressed in this capstone project is the difficulty many newly graduated nurses experience when transitioning into medical, surgical, and telemetry practice settings. New nurses are often expected to manage complex patient assignments, recognize patient deterioration, communicate effectively with interdisciplinary teams, and prioritize care while still developing professional experience. Research shows that these challenges may contribute to stress, burnout, decreased confidence, and patient safety concerns. From Kavanaugh and Sweda 2017. Because of these challenges, healthcare organizations continue searching for evidence-based educational strategies that better support novice nurses during their transition into practice. The transition from student nurse to practicing registered nurse is recognized as one of the most stressful periods in nursing practice. Newly graduated nurses may struggle with time management, delegation, prioritization, and clinical reasoning in fast-paced acute care settings, cited from Tanner, 2006. This issue is especially important in medical, surgical, and telemetry units because patients often have rapid changing conditions that require quick decision-making and effective communication. Education intervention that was experiential learning and reflective debriefing may help improve competency development, workforce preparedness, and patient safety outcomes. Quoted from Ferranda et al. 2020. The literature review demonstrated shows strong support for experiential learning interventions in nursing education. Studies found that guided clinical scenarios and reflective debriefing improve knowledge retention, communication skills, clinical reasoning, and prioritization abilities. Research also showed that competency-based transition programs may improve nurse retention and reduce transition-related stress among novice nurses, cited from Kent and Cooper, 2017. The evidence suggests that structured educational programs can better prepare newly graduated nurses for the demands of high acuity patient care environments. This capstone project is guided by Tanner's clinical judgment model, which includes noticing, interpreting, responding, and reflecting. This model supports development of nursing judgment by encouraging nurses to recognize patient cues, analyze clinical information, respond appropriately, and evaluate outcomes through reflection, cited from Tanner, 2006. This framework aligns closely with the goals of this project because newly graduated nurses must strengthen decision-making abilities and prioritization skills to safely care for patient and acute care settings. The proposed intervention is a 4-week experiential learning program designed for newly graduated nurses working in medical, surgical, and telemetry units. This program includes weekly high acuity patient scenarios, communication exercises, guided reflective debriefing sessions, and competency evaluations. The overall goal is to strengthen clinical reasoning, communication, prioritization, and patient safety awareness while improving transition to practice preparedness. Experiential learning allows novice nurses to apply theoretical knowledge in realistic clinical situations while minimizing patient risks. Several ethical considerations were identified within this project. Participation would remain voluntary, and confidentiality would be maintained by protecting participant information and using de-identified data when appropriate. Participants would receive informed consent information explaining the purpose of the project, expectations, and their right to withdraw at any time without penalty. Although the project focuses on educational improvement and may qualify as a quality improvement initiative, institutional review, board review, or exemption determination would still be obtained before implementation to ensure compliance with ethical standards. Quoted from Pullett and Beck, 2021. Expected outcomes include both qualitative and quantitative improvement. Quantitative outcomes may include improved competency assessment scores, reduced communication errors, and increased adherence to patient safety protocols. Qualitative outcomes may include improved self-efficacy, communication, interdisciplinary collaboration, and professional preparedness among newly graduated nurses. Overall, the intervention is expected to strengthen workforce preparedness and support safer patient care practices. This project may contribute significantly to nursing education and healthcare delivery. The intervention supports competency-based orientation programs and may improve workforce retention, patient safety, and transition to practice outcomes. Further implications include expanding the program into additional specialty areas, developing standardized transition programs, and conducting further research evaluating long-term patient outcomes and nurse retention rates. This project may also support organizational initiatives focused on reducing turnover and improving clinical competency among novice nurses. Potential implementation barriers include staffing shortages, limited financial resources, scheduling difficulties, and resistance to educational change. Healthcare organizations may also face challenges related to educator availability and balancing educational activities with patient care demands. Strategies to address these barriers include leadership support, phased implementation, flexible scheduling, and ongoing competency evaluations to demonstrate program effectiveness. In conclusion, this capstone project addresses the challenges newly graduated nurses face when transitioning into medical, surgical, and telemetry practice environments. Evidence suggests that experiential learning interventions may improve clinical reasoning, communication, competency development, and patient safety awareness. Supporting novice nurses during their transition into practice is essential for improving workforce preparedness, reducing stress, and promoting safer patient outcomes. Thank you for listening to my presentation. I welcome any feedback.